That sudden moment of worry hits hard, doesn't it? Your cat, usually so enthusiastic about mealtime, suddenly just snubs their food. Maybe it's just a day, but then it stretches into two. Today, we're diving deep into a serious liver issue in cats, feline hepatic lipidosis, and, it often starts right there with a change in appetite.
Exactly. Feline hepatic lipidosis, that's what we'll be exploring thoroughly.
And to really get a handle on this condition, we've got a pretty comprehensive veterinary article. It covers, well, everything from diagnosis right through to the latest treatments.
Yeah, it's quite detailed.
Think of this as your shortcut, maybe, to understanding this complex health challenge.
Right. Our goal in this deep dive, really, is to make feline hepatic lipidosis clear, understandable. We want to explain what it is, the unique reasons why cats seem so susceptible, how vets diagnose it, and, the current treatment strategies. Ultimately, we just aim to equip you with some valuable knowledge.
Because, let's face it, for any cat owner, knowing about hepatic lipidosis is vital. Spotting those early shifts in appetite, understanding why quick vet care is so crucial, it can really make a difference.
Absolutely.
Okay, let's unpack this then. What is hepatic lipidosis exactly?
Okay. So, simply put, feline hepatic lipidosis is when over 80% of a cat's liver cells become overloaded with fat, specifically triglycerides.
Wow, 80%, that's a lot.
It is. This isn't just a little extra padding. This significant fat accumulation physically squeezes the tiny bile ducts within the liver.
Which sounds like a major complication brewing right there.
It is, absolutely. This compression leads to severe cholestasis, fancy term, but it just means the flow of bile gets blocked.
Right.
And as a result, the liver just can't do its job properly. And it's crucial to know that if it's left untreated, this condition can trigger a whole cascade of metabolic problems that can unfortunately be fatal.
So definitely not something to ignore. And the article mentioned it usually develops because of something else going on.
Precisely. Hepatic lipidosis is almost always a secondary issue. It develops as a result of another underlying disease or, a situation that causes the cat to stop eating or lose a significant amount of weight, a state we call catabolism.
Okay, that explains the what, but why cats? What makes their systems particularly prone to this kind of liver overload?
Here's where it gets really interesting. Cats just seem to have this unique tendency for fat to build up in their liver cells. Several factors contribute to this special predisposition.
Okay, tell us more.
Well, firstly, when a cat doesn't eat enough or isn't getting enough protein, they develop these energy and protein deficits.
Makes sense.
This signals the body to start breaking down fat reserves from other areas and send that fat to the liver for processing. At the same time, the liver itself actually starts producing more triglycerides.
So it's like the liver gets hit with a double whammy of fat coming in and being made there.
Exactly. That's a great way to put it. But the problem doesn't even end there. Cats are also, not as efficient at breaking down these fats in the liver. That process is called beta oxidation.
Okay.
And even when they do process some fat, their liver cells are less effective at actually shipping the resulting triglycerides out of the liver. It's kind of like a factory that's overloaded and also can't get its products out the door.
It really does sound like a perfect storm for fat to just pile up in the liver.
It is. And as these fat vacuoles, these tiny pockets of fat, multiply inside the liver cells, they start physically pushing aside all the other essential bits of the cell, the organelles.
Right.
This physical pressure leads to the liver cells not functioning correctly and, like we said, contributes to blocking those vital bile flow pathways.
And with all this fat taking over the liver, can it lead to complete liver failure?
It absolutely can progress to liver failure. Interestingly, though, the article mentions that overt hepatic encephalopathy, that's brain dysfunction caused by liver failure, it's relatively uncommon in cats with just hepatic lipidosis compared to some other liver diseases.
So the primary problem is really the sheer volume of fat disrupting how the liver works. Now, this liver dysfunction, it doesn't happen in a vacuum, right? The article talks about a ripple effect on other body systems.
That's a great analogy, yeah. The hepatobiliary system, liver and bile ducts, is obviously hit hard. Severe cholestasis, liver dysfunction, potential failure. But the lack of appetite and sometimes vomiting also severely affect the gastrointestinal system. And you also see muscle wasting because the body starts breaking down muscle tissue for energy when it's desperate.
And it can even impact the nervous system. You mentioned encephalopathy is rare, but
Yeah, while severe brain dysfunction is less common, the article notes the possibility of hepatic encephalopathy.
Oh.
Also things like excessive drooling and just a general state of significant weakness. Regarding blood, lymph, and the immune system, you might see abnormally shaped red blood cells, we call them poikilocytes, and even the destruction of red blood cells sometimes.
Wow.
And finally, the kidneys can get involved too, leading to potassium loss and, interestingly, fat buildup in the kidney tubules themselves.
It paints a really serious picture of how widespread the effects can be. So how frequently does this actually happen? Is hepatic lipidosis something vets see often?
Well, the article indicates it's actually the most common severe liver disease that causes jaundice in cats in North America.
Really? Most common.
Yeah, so it's definitely a significant concern in feline medicine.
And are there specific types of cats or maybe ages where they're at higher risk?
It seems to primarily affect middle-aged adult cats.
Mm.
The average age is around 8 years, but honestly, the range is pretty wide, like 1 to 16 years.
Okay.
Doesn't seem to be a specific breed or sex that's more susceptible. However, there are certainly identifiable risk factors.
Right. Okay. What are those key risk factors we should be aware of?
Obesity, that's a major one.
Mm-hmm.
Additionally, any prolonged period of not eating anorexia that results in a negative protein balance in the body increases the risk significantly.
Okay.
Conditions that cause the breakdown of body tissues or just lead to rapid weight loss, those are also big contributors. And lastly, a deficiency in vitamin B12 can also make a cat more vulnerable.
So the critical takeaway here seems to be that anything preventing a cat from eating properly for, more than a day or two really puts them at risk.
That's exactly it.
Those risk factors make a lot of sense, given what we discussed about fat mobilization and liver function. Now, if a cat is developing hepatic lipidosis, what are some of the signs an owner might notice at home? What are the historical clues?
Yeah, there are several things that should ring alarm bells. Anorexia, a complete refusal to eat, is a big one. But even hyperexia, just a significant reduction in appetite, is really important.
Right, not just zero appetite.
Exactly. Owners might notice their cat losing weight, particularly muscle mass. And they might observe jaundice, that yellowing of the skin, the gums, even the whites of the eyes sometimes.
That yellowing seems like a pretty clear warning sign.
It really is. Other signs can include just lethargy, weakness, sometimes progressing to the point where they can't even stand properly. Vomiting can happen, changes in bowel habits like diarrhea or constipation.
Okay.
And interestingly, some cats will show excessive drooling. That could be nausea, maybe food aversion, or in rare cases, some brain involvement.
Uh-huh.
A very specific sign mentioned is neck ventriflexion, where the neck is bent downwards, head towards the chest.
What?
That's usually due to severe muscle weakness and electrolyte imbalances.
Wow, that's specific.
It is. And it's also really important to remember you might see signs of whatever underlying condition actually triggered the lipidosis in the first place.
Right, because it's usually secondary. And what might a veterinarian find during the physical exam itself?
Well, jaundice is often pretty evident on exam. The liver might feel enlarged when the vet palpates the abdomen. Dehydration is common. Weakness, definitely sometimes severe enough to cause that neck ventriflexion we talked about, or even the inability to stand at all. The drooling might be observed. And in really severe cases, the cat might be collapsed or just unresponsive.
So a combination of what the owner saw and what the vet finds starts to build the picture. Now, the article touches on the causes, and it makes a really interesting point about the term idiopathic.
Yes, it does. The article strongly suggests that labeling a case idiopathic, meaning of unknown cause, is often, well, not quite accurate. They state that in over 85% of cases initially labeled this way, if you dig deeper, further investigation uncovers some preceding health issue that led to the anorexia or poor nutrient absorption.
Over 85%.
Yeah. The remaining, maybe 15% or less, might simply be due to straightforward starvation, like a cat getting trapped somewhere.
Yeah.
So even if the initial trigger isn't obvious, there's almost always something underlying that needs investigating.
That's a really significant point. So what are some of these common secondary causes? The article gives quite a list.
It does. Covers a really wide range. Primary liver diseases themselves can trigger it, things like certain vascular problems in the liver, inflammation of the bile ducts, which is cholangitis, gallstones, even liver cancer.
Okay.
Gastrointestinal issues are also really common triggers. Think obstructions, cancers like lymphoma, inflammatory bowel disease, and pancreatitis is a big one too.
Right. Pancreatitis seems linked to a lot of things in cats.
It really does. Then you have urogenital problems, kidney failure, chronic kidney inflammation, feline lower urinary tract disease, or FLUTD. Neurological conditions that just prevent a cat from being able to eat.
Mm.
Infectious diseases, too, like toxoplasmosis, FIP, feline infectious peritonitis, and problems linked to FAV or FLV.
Wow, quite the spectrum.
Yeah, and the list continues. Hyperthyroidism, vitamin B12 deficiency again, and even rapid weight loss protocols if they're not managed super carefully.
That's a really comprehensive overview of potential triggers. So when a vet suspects hepatic lipidosis, what's the process? How do they figure out exactly what's going on and rule out other things?
Well, the diagnostic process involves thinking about several differential diagnoses first. Other liver diseases have to be considered. Pancreatitis, like we mentioned, GI issues,
Yeah.
toxicities, hyperthyroidism. Rule those out or in.
Okay. And what are the key tools vets use to unravel this mystery?
Blood work is absolutely essential. There are several common abnormalities you see. High bilirubin levels that reflects the jaundice. Elevated liver enzymes, specifically ALT and AST, which indicate liver cell damage.
Right.
Interestingly, another liver enzyme, GGT, might be normal or only mildly up, unless there's a primary issue with the bile ducts or the pancreas alongside it.
Okay, that's a useful distinction.
Yeah. Other findings can include low BUN, variable glucose and cholesterol, variable protein levels like albumin and globulins, definitely low potassium often, and potentially severely low phosphorus. That's a big one to watch.
Phosphorus, okay.
The blood smear might also show those funny-shaped red cells, the poikilocytes, and often a non-regenerative anemia, meaning the body isn't making new red blood cells properly.
So the blood work gives a ton of clues about the liver and the body's overall state. What about other lab tests?
Urinalysis often shows fat droplets in the urine, called lipiduria, and the urine might be quite dilute. Other lab tests might reveal prolonged clotting times, things like PT, APTT, ACT, PIVKA tests, and sometimes low vitamin B12 levels confirm that suspicion.
And imaging. How important is that?
Oh, imaging plays a really significant role. Both X-rays and ultrasound are valuable.
Okay.
X-rays might show an enlarged liver, maybe hint at underlying issues, but abdominal ultrasound is particularly useful here.
How so?
It often shows a liver that looks diffusely brighter than normal on the screen, what we call hyperechoic. That's a strong indicator of fat accumulation. And just as importantly, ultrasound is crucial for hunting for those underlying causes like masses, inflammation in the pancreas or intestines, gallstones.
Got it. So imaging helps confirm the fatty liver and search for the trigger. What about actually sampling the liver itself?
Yeah, liver sampling is often the final sort of definitive step,
Yeah.
especially for confirming the HL itself or finding other issues. Fine needle aspiration, or FNA, is usually the first approach.
Okay.
It's minimally invasive. A very thin needle gets a small sample of liver cells. And in over 80% of hepatic lipidosis cases, that FNA will show severe fat inside the liver cells. Often, you don't need a bigger biopsy just to confirm the HL.
But when is a full liver biopsy necessary then?
A liver biopsy, which takes a larger tissue sample, is considered the gold standard for diagnosing underlying primary liver disorders, like certain types of inflammation or cancer within the liver itself.
Right.
It's usually done if the cat isn't responding to treatment as expected, or if their GGT levels are really high, suggesting maybe a primary bile duct problem. The article does stress, though, you have to stabilize the cat first
Like that.
because of the bleeding risk. The liver makes clotting factors, and if it's not working well and you do a biopsy, you need to be careful. So stabilization before anesthesia and biopsy is key.
That makes perfect sense. So once the diagnosis is confirmed, what does treatment actually involve? It sounds like it needs to be pretty intensive.
It really does. Treating hepatic lipidosis requires a comprehensive, often intensive approach. Initial stabilization is absolutely paramount. And inpatient hospitalized care is frequently necessary, especially for cats that are very weak or have those significant electrolyte imbalances we talked about.
Okay, so what does that initial stabilization typically include? Fluids.
Yes, nursing care is vital. This involves giving carefully balanced intravenous fluids. Often 0.9% saline is preferred, and we generally avoid fluids with lactate or dextrose initially.
Right.
Potassium supplementation is almost always needed, and phosphate supplementation is also crucial, especially when you start feeding the cat again, to prevent something called refeeding syndrome.
Yes, refeeding syndrome. Can you explain a bit more about why that's such a concern here?
Sure. Refeeding syndrome is a potentially life-threatening issue. It happens when a severely malnourished animal starts getting nutrition again, maybe too quickly. The sudden metabolic shift can cause electrolytes, particularly phosphate, but also potassium and magnesium, to plummet rapidly into the cells.
And that causes...
All sorts of serious problems, severe weakness, heart issues, neurological problems, red blood cell destruction. It can even be fatal. That's why very careful monitoring of electrolytes and a gradual reintroduction of food are so incredibly critical.
Wow. So it's not just about jamming calories in, it's about doing it safely so their system can handle it. The article also mentioned addressing liver antioxidant depletion.
That's right. The liver's main antioxidant, glutathione or GSH, is often depleted in these cats. This makes the liver cells more vulnerable to damage.
So what do you do?
Well, we don't routinely measure GSH levels, but we know the risk is high. So N-acetylcysteine, or NEC, is often used intravenously in critical situations to help boost glutathione. Then, once the cat's more stable and tube feeding has started, S-adenosylmethionine, SAMe, can be given orally for longer-term antioxidant support.
Okay. And then there's the nutritional support itself, which the article really emphasizes as the absolute cornerstone of recovery.
Absolutely. Providing adequate nutrition is the single most critical aspect
Yeah.
of treating hepatic lipidosis, period.
So what kind of food?
It involves feeding a high-protein, high-calorie diet specifically formulated for cats. Vets calculate the cat's daily energy needs, usually around 50-60 kilocalories per kilogram of their ideal body weight, and then work up to that full amount gradually over several days, giving multiple small meals throughout the day via the tube.
And how do you actually get enough food into a cat that just refuses to eat? You mentioned tubes.
Yeah, forced oral feeding, like syringe feeding, is often tried by owners, but the article strongly advises against it. It often creates a really strong, lasting food aversion, making things much harder later.
Okay, so tube feeding is the way.
It's the preferred and most effective method, yes. Initially, maybe a nasogastric tube, a small flexible tube through the nose down to the stomach, might be used for short-term feeding and stabilization.
Right.
But often, once the cat is more stable and they've had vitamin K1 to help with clotting, this is switched to an esophageal feeding tube, or E-tube.
How's that placed?
An E-tube is placed through a small incision in the neck directly into the esophagus. It sounds a bit dramatic, but it's actually very well tolerated and allows for much easier, more comfortable long-term feeding at home.
Okay.
The article strongly cautions against surgical gastric feeding tubes, ones that go directly into the stomach through the body wall. They've been associated with significantly higher mortality rates in these specific cats.
That's a really important distinction for owners facing this. What about nutritional supplements? The article listed quite a few.
Yes, several supplements can really help support recovery, especially in severely affected cats.
Yeah.
L-carnitine helps the liver utilize fat for energy. Taurine is essential for cats anyway. Thiamine and vitamin B12 are often deficient and crucial for metabolism. Water-soluble B vitamins are often added to the IV fluids. Vitamin E is an antioxidant. We already mentioned the thiol donors, NAC and SAMe. Potassium gluconate might be needed orally if potassium stays low. And marine oil, like fish oil, provides beneficial omega-3s.
Got it. And are there any specific medications typically used alongside all this support?
Yes. Vitamin K1 is essential if there's any sign of bleeding or if clotting times are prolonged. Antiemetics, anti-sickness medications, are really important to control vomiting and nausea. And antibiotics might be needed if there's evidence of a concurrent bacterial infection somewhere.
Okay. On the flip side, are there treatments or medications that should definitely be avoided in cats with hepatic lipidosis? The article had a list for that too.
Yes, definitely things to steer clear of. Certain sedatives like benzodiazepines, diazepam, and barbiturates should generally be avoided, as they can sometimes worsen brain function if there's underlying liver compromise. Appetite stimulants like diazepam are also generally not recommended. They don't fix the underlying nutritional deficit and can have side effects. Injectable meds containing propylene glycol need caution, as they can potentially harm red blood cells if glutathione is low.
Okay.
Ursodeoxycholic acid, sometimes used for other liver issues, isn't thought to help here and might even be harmful. Dextrose-containing fluids need caution, as they could potentially worsen fat buildup.
Any others?
Certain antibiotics like tetracyclines and the anabolic steroid stanozolol are best avoided, as they can actually promote fat deposition in the liver. And finally, propofol, a common anesthetic, needs careful use due to the risk of red blood cell damage, specifically Heinz body formation in these cats.
That's a really valuable list of what not to do. So how do vets track a cat's progress during all this treatment, and what does the long-term outlook generally look like?
Monitoring involves regular checks, body weight, body condition score, hydration, and definitely electrolyte levels through blood tests. Serum bilirubin, the jaundice level, is actually a pretty good indicator of recovery. It typically starts to fall within about 2 weeks of consistent, effective feeding and management.
Okay, so bilirubin is key. What about liver enzymes?
Interestingly, the liver enzyme levels in the blood, like ALT and AST, tend to normalize much more slowly, sometimes taking weeks or even months. So they aren't the best guide for immediate day-to-day progress.
Got it. And when is a cat usually well enough to potentially go home?
Discharge for home care with a feeding tube is generally considered when vomiting is controlled, any stomach motility issues are resolved, the bilirubin is clearly trending down, the cat can walk okay on its own, and importantly, the owner feels comfortable and confident managing the e-tube feeding at home.
Right, the owner needs to be prepared.
Absolutely. And that tube typically stays in until the cat is consistently eating enough food voluntarily on its own for several days.
What about preventing this from happening in the first place? Any tips there?
Prevention really focuses on maintaining a healthy body weight. Avoiding obesity is key, and being vigilant about food intake. Seek vet attention promptly if you notice any significant decrease in appetite, especially if it lasts more than a day or two. Also, careful monitoring is needed during any planned weight loss programs or even just stressful periods for the cat.
Are there any potential complications during treatment that owners and vets should watch out for?
Yes, complications can happen. Issues with the feeding tube itself, blockages, infection at the site, although rare, that hepatic encephalopathy, the brain issue, can sometimes develop or worsen shortly after starting nutrition.
Okay.
And unfortunately, in some very severe cases, if the liver damage is just too extensive or if the underlying cause can't be treated, liver failure leading to death is still a possibility, despite best efforts.
But overall, what's the general prognosis? Can cats recover from this?
The article offers a generally optimistic outlook, actually. With appropriate and timely treatment, especially involving that tube feeding and supportive care, the majority of cats, around 85% of those severely affected, can make a good recovery.
85% is pretty good.
It is. Recovery usually takes about 3 to 6 weeks of dedicated care. It's important to remember, though, that the nature and treatability of whatever caused the anorexia in the first place significantly influence the final outcome.
Right.
But the good news is, once a cat recovers from hepatic lipidosis, recurrence is rare. And the condition doesn't typically lead to chronic long-term liver dysfunction. They usually bounce back completely from the HL itself.
That's really reassuring to hear. So to just summarize our deep dive here, what are the absolute key takeaways you want our listeners to remember about feline hepatic lipidosis?
I think the main points are, it's a serious but often treatable liver condition in cats. It's usually triggered by a period of not eating enough, leading to that dangerous fat buildup and liver dysfunction. Early recognition of the signs, any drop in appetite, any hint of yellowing and getting prompt, aggressive nutritional support, which almost always means a feeding tube, are absolutely critical for giving them the best chance of a positive outcome.
This has been incredibly informative, really useful stuff. It makes you think, though, considering just how many different underlying health issues can potentially lead to hepatic lipidosis, what are some proactive ways you, as an owner, can really stay on top of your cat's overall health and eating habits to maybe catch potential problems super early?
That's a great question. And, given how uniquely susceptible cats are to this, it really highlights how sensitive their whole metabolic balance can be. Makes you wonder, what other seemingly minor changes in a cat's daily life might also have surprisingly significant physiological consequences down the line?
Definitely food for thought. So if you have any concerns at all about your cat's appetite, their energy levels, their general health, please don't wait. Reach out to your veterinarian right away. And if you found this deep dive helpful, please consider sharing it with other cat owners you know. It could make a real difference.